Okay, the next topic we're going to talk about are antipsychotics. These can also be known as tranquilizers or neuroleptics. These drugs are going to produce a state of tranquility and acts on abnormally functioning nerves. So these drugs can be used for drug-induced psychoses, schizophrenia, autism, extreme mania as an adjunct to lithium, bipolar disorder, and depression resistant to other therapies. So if somebody has depression and it's not being helped by another drug, they can take one of these. Adverse effects include agranulocytosis and hemolytic anemia, drowsiness, postural hypotension, gynecomastia, insulin resistance, weight gain, neuroleptic malignant syndrome, extrapyramidal symptoms, and tardive dyskinesia. So there are 7 drugs right here. There's not a lot about each drug, just different names. And then these 3 right here have different little fun facts about them. We have chlorpromazine, haloperidol, clozapine, olanzapine, quetiapine, risperidone, and ziprasidone. I don't know how to say these drugs. They're like a whole tongue twister in your mouth. Okay, so chlorpromazine can help with uncontrolled hiccups. I'm going to remember that because if you're going to prom, you're probably not going to want to have hiccups. So I don't know, maybe that'll help me. Prom, hiccups. You're not going to want to have hiccups at your prom. Haloperidol is long-term therapy, and long-term therapy of this drug may lead to extrapyramidal adverse effects. So these are the drugs that some young patients in their 20s may be given, and they don't realize that, okay, once you're off this drug, you could still have this long-term effect of extrapyramidal symptoms. So that's not a good thing. Clozapine, there's little to no extrapyramidal effects. It's the drug of choice in patients who also have Alzheimer's. But with this drug, you need to monitor their white blood cell count weekly because this drug can cause agranulocytosis and hemolytic anemia. So if you look underneath the adverse effects, this drug clozapine is the one that can cause those 2 at the very beginning. The other 4 drugs, we don't have anything specific that we need to know about them, just that they're antipsychotics and these things apply to them. Olanzapine, quetiapine, risperidone, and ziprasidone. I'm going to pause it. I'm going to let you pause it or screenshot it right here so you can know how to spell these words. But again, I'm butchering how to say them, but there's a lot of different letters and a lot of different consonants and vowels that have sounds. So there we go. Okay. That's it for antipsychotics.